I'm going to be talking about your PPIs, or your proton pump inhibitors. First of all, PPIs are very, very common. You will see them in many, many patients. They are used for a variety of gastroesophageal conditions, which I'll talk about further when we get into the specific PPIs. But importantly, you might see them in a cardiology sense because they often can be used in high-risk patients. Patients taking aspirin, NSAIDs, antiplatelets, and anticoagulants. So you might see them even in a cardiology clinic, even though technically they're used for more gastric esophageal problems. The PPIs work by irreversibly blocking the hydrogen potassium ATP enzyme in your gastric parietal cells. So these are the cells that produce the acid, and as a result, reduce acid secretion by up to about 99%. PPIs, again, as I mentioned previously, are typically used for gastric protection in those patients who are taking aspirin, as aspirin can really cause some gastric issues. And overall, your PPIs have a duration of action of about 24 hours and take about 3 or so days to reach maximal effect. Now, other people may be taking H2 blockers, which also helps with acid secretion and gastric esophageal problems. The problem with H2 blockers, though, is that they don't provide much meal-stimulated control of dyspepsia or stomach problems. Also, your H2 blockers can have serious side effects with high doses, which you don't see with a PPI. And PPIs also don't produce any inhibition, or at least no significant inhibition, of your CYP 450 that H2 blockers can. So some of the common PPIs we're going to be talking about are omeprazole or Prilosec, lansoprazole and Prevacid, pantoprazole, which is Protonix, rabeprazole, which is Aspirin, and esomeprazole, which is Nexium. Omeprazole or Prilosec is a very common PPI. The good thing about it is that it generally has few side effects. You might see some patients who get headaches from it or abdominal pain from it, but generally has few side effects and has a variety of uses. So it's indicated for duodenal ulcers, H. pylori infection, gastric ulcers, GERD, erosive esophagitis, and Zollinger-Ellison syndrome. Lansoprazole also has very few adverse effects, again, headaches. This can also cause some diarrhea. Typically, this, again, has indications for heartburn, gastric ulcers, NSAID-associated gastric ulcers, again, which you might see commonly, GERD, erosive esophagitis, Zollinger-Ellison syndrome, as well as H. pylori infection. Pantoprazole is useful in the sense that it can be given IV, like the other PPIs. Again, very few side effects, but headaches can occur, and you also might get some abdominal pain. Pantoprazole is used in erosive esophagitis treatment, as well as some short-term treatment for GERD, can be used for peptic ulcer disease or, again, Zollinger-Ellison syndrome. Rabeprazole is your PPI that you're generally going to use for H. pylori eradication. It tends to be the preferred PPI to use, but it can also be used in duodenal ulcers, GERD, Zollinger-Ellison syndrome. Like the other PPIs, it can cause some headaches and also some diarrhea. Esomeprazole, in addition to being IV, in addition to being oral, the benefit of esomeprazole is that it has generally a long half-life, and so it tends to be preferred over some of the others for that reason. Again, very few adverse effects, some headaches, but it can have associated flatulence. The indications you can see here, one of which is being, again, NSAID-induced gastric ulcers, or just a risk reduction of NSAID-associated gastric ulcers, not necessarily treatment, but perhaps prophylaxis as well. And then the other indications you can see listed here. And that is it for PPIs.